This animation shows how a central line is put in. It's also sometimes called a skin-tunneled venous catheter. You may have a central line put in when you have cancer treatment. A central line is a thin, flexible tube that is placed in a vein close to your heart. It's used to give intravenous fluids and medicines like chemotherapy and drugs. It can also be used to take blood. Having a central line means you don't need to have repeated injections or needles. Once it's been put in, it can stay in for weeks or months. It can stay in until all your treatment is over. The central line is put in by a specialist nurse or doctor in hospital. First, the skin in the area is cleaned. Then, the area is numbed with anaesthetic cream or injection. A general anaesthetic can sometimes be used. The central line goes in through a small cut in the skin near the collarbone. One end of the line is gently threaded into a large vein just above the heart. The other end of the line is then tunneled under the skin to come out of the chest. This is called the exit site. You will have dressings to cover the area where the tube comes out of the exit site. Having a line put in shouldn't hurt because of the local anaesthetic, but it might be slightly uncomfortable. After it's put in, you'll have a chest x-ray to check that the line is in the right place. At the end of the central line is a needleless connector. The nurses will use this for everything they give you through your central line and for taking blood. Before you go home, the nurses will show you how to look after your central line. Most people don't have any serious problems with the central line, but can sometimes get blocked or infected. If you have any questions about your central line, ask your doctor or nurse. For information, support or just someone to talk to, call the Macmillan Support line on 0808 808 0000 or visit macmillan.org.uk.